Hi, I'm Dr. Desiree Cox. Thanks for reaching out to me on Facebook and saying hi. Thanks for subscribing to my channel, all of you who sent me amazing comments and also how to improve things. But one of the questions that kept coming up was, say a bit more about yourself, Desiree, and this from particularly from people who know me, and why you're doing this, who you're talking to, and why you wanted to reach these particular people. And so before we start recording, we're going to start recording the materials for the Healing University. I wanted to just take a couple of minutes and share a bit about myself. So I started it's been about 30 years. It's hard to imagine. I went to medical school at Oxford University, and I went there after studying quantum chemistry and quantum mechanics at McGill. I was fortunate enough to go there as a Rhodes Scholar, and everything was fine really until I hit the clinical part of medicine. And then, I can't tell you why this was. It was like an instinct, an internal intuition that it was so primitive, this medicine we were practicing. And it wasn't primitive because of the tests or the machines or what the machines could do. I was studying at one of the best universities in the world. And so it was not easy to even talk about that because everyone was so proud to be there. And here I was with this sense that this medicine was so primitive. And so I began to talk about that to my Rhodes Scholar friends and colleagues who were studying all sorts of other things. And they introduced me to people like Thomas Kuhn, Susan Sontag, Oliver Sacks, people who were taking a different perspective of this thing called medicine. And so I boiled my questions down to this. How did we get the medical system that we currently have? And the randomized controlled clinical trial was like a window of looking into that because it's the methodology of how we know whether our therapies are working or not working. And so I began to read everything I could about that. I decided when I was done medicine, I would go to Cambridge and study that. And I would look at the social, cultural, historical, methodological issues that shaped this randomized controlled clinical trial with the view to understanding how we got the medical system that we had. And I wasn't just interested in the system we had, I wanted to know how we could create something else. So if you understand what you've got, how you've gotten there, then you get a better way of understanding how to get something else. I specialized afterwards and worked in clinical medicine on the front line like so many healthcare professionals, and really it became clear to me that I was meant for something else, that my role in the world was bridging the creative and the left and the right brain, that I was doing something I wanted to do something that was a healthcare entrepreneur, but I didn't know what that was. So scroll forward 15 years, I've been a university professor, I've been a consultant to pharmaceutical industries, I've done all sorts of things, all of it getting a closer window of what to do, of how medicine works, and with a way of hacking into the medicine that we have to create something better. Because my vision is self-efficacy, and that's now an emerging paradigm in medicine in which all of us are able to take care of ourselves. We know what to eat, what to do, and that we only use tertiary care in the most extreme instances. And I know for many of you healthcare professionals, people are coming to you. What do I do? I hear about the stem cell stuff. I hear about this regenerative medicine. You want to know how to help them and how to recommend things to them. But there isn't the time. So that's one group. The second group are the healthcare, the biotech founders, the entrepreneurs, the investors. I've become one of you. I've become a maker. I didn't intend to become a maker. I didn't know what that was. But a friend of mine told me this amazing analogy for what it is we do. A rocket burns about 90% of its fuel in the first, 50 seconds. It takes that much to burn. It has to burn that fuel to escape gravity and get off the ground. And then it's got about 15 seconds before it reaches the thicker area of the atmosphere. And most rockets explode at that point because you need to be built to be able to navigate that to then now circle around the Earth like satellites do. So that's the same for all of us. In fact, it's true of almost everything. So for that, you need energy, You need to know what to be eating. You need to have a team. You need to know who's in the team. You need to have that team to be inspired. And all of that is a health issue. That's about being creative. And so these programs are also for you. And the videos, the raw videos, which you're going to see lots of with dogs barking and the ocean crashing and all of that. That's me kind of showing you how I'm doing it in reality. And the final group are the biohackers. I never really saw myself as a biohacker, but I'm trying to hack into the body to get maximum performance. I'm trying to live as long and as well as I can. And so in that sense, if you're identifying with that, you're also a biohacker. So over the next 365 days, I'm going to be posting short videos, but HealLink University is also going to be the place you come to find out what to eat, where to go, what to do. If you want to go plant-based, where's the best place to do that? If you want to find a way to bring creativity into your life, how do you do that? I'm a visual artist over the last 10 or so years. I didn't start off that way. I didn't even know I was an artist. I was a musician, but I didn't know I was an artist. So how do you integrate all of that in your life? That's what regenerative health and the new vision of regenerative health is about for me. So we're looking to pull together things that now live in these multiple silos: stem cells, regenerative medicine, biotechnology, all the tech that's out there, hyperbaric oxygen chambers, as well as the ancient wisdom of healing, meditation, music, creativity, breath work. We're bringing all of that together because that is what we need to do in our lives for regeneration, for biotech founders, for biohackers, and for you healthcare providers who want to give the best possible advice to people who come and see you. So that's it for me. Cheers. Subscribe to the YouTube channel. I want to know more from you. Reach out to me on Facebook, Twitter. You're going to see me turning up on more of those media, learning about it. Bear with me. I'm in the preschool stage of that process, but that'll change. Cheers. Bye.